This is Heartland Focus with Tim Clark.
Hello. Welcome to Heartland Focus. I'm your host, Tim Clark. And as you can see, my guest is Dr. Hughes, Director of Health for Douglas County. Welcome back to Heartland Focus. I appreciate, this is my birthday week, and thank you so much for the balloons. I appreciate that.
Absolutely, and thank you for having me on, and I hope you have a fantastic birthday.
Yes, I tell you, in life, it's been cold, and but you know what? Still, it's a blessing to be able to wake up and be able to say, "Hey, you're one more year older." And
Absolutely.
so, I thank everyone for all of the well wishes and happy birthdays, for just taking the time, because really, truly, when you think about what's happening now, people really don't have to take the time. And just to say happy birthday, and then for that, I just want to just let everybody out there know that I appreciate folks taking the time, and I appreciate you taking the time and stopping somewhere to get some happy birthday balloons. You know?
Absolutely, you're worth it.
I appreciate that. Well, I tell you, although this is birthday, you want to celebrate, and it's been a great weekend for me, but we're here to talk about some dang health challenges, and so I'm gonna put my birthday balloons down here, so we can have hopefully no distractions there. But yeah, how you doing? So you've been on the job now? How long has it been?
It's been exactly 6 months.
6 months.
Yes, I think today is actually my 6-month anniversary.
Wow. And I tell you, every day has been a run, if not a sprint.
It's been a roller coaster for sure.
Yeah. But I tell you though, you're here, right time, right person. I've really enjoyed our conversation, and really appreciate your work, and attentive to, and really being intentional about what we need, what's in front of us. So thank you, man. Hopefully 6 months in that you're gonna decide to stay with us after a year.
Well, Commissioner Rogers assured me that y'all are stuck with me now, so.
Okay. Good choice, Commissioner Rogers. Good choice.
I'm pretty grateful to have you all stuck with me. Although it has been a roller coaster, it's been a fantastic experience.
Yeah.
I have just so enjoyed getting to know the community, and just to integrate into this great place where the people here are just really fantastic people.
High levels of care. I think people, one thing about, when I was at the Chamber of Commerce, I did some work there, and one of the things that we used to say, that Omaha, Greater Omaha area is kind of like a unfinished symphony, where that we really, as you know, in my background is being an artist, I always try to connect those when I can, but it really is. I think we do what we need to do to rally the troops, pull together for the common good of humanity and what makes sense in terms of our communities. And so with that in mind, Dr. Hughes, if you could, just really kind of give us a high level, the state of this crazy, insidious virus, now variants that keeps going, and we're into our second variant now, or third variant. Give us a high level where we're at, and then really I want to talk about I want to spend more time in terms of how do we win this. I look at it as a war.
Yeah.
How do we win? But give us kind of where we're at, and then we can figure out strategies of winning.
Absolutely. So crazy and insidious is a great description for the virus and really what we're experiencing right now. Our case rates have actually tripled in the past couple of weeks. So we went from seeing just over 300 cases per 100,000 for a 7-day total to over 1,000 today. So we have seen just an astronomical jump in cases. If you look at our charts, it's almost a vertical increase. You can see on that chart there over to the right, that straight line going up. That's where we are right now. And so, definitely, we're in a situation right now where it's all hands on deck, and we need everybody's assistance to get this to come back down. This is most likely driven by Omicron. The most recent data that I saw this morning was that of those samples that get sequenced, 88% of them came back as Omicron. The rest of those were a mix of Delta and some other earlier variants, but clearly predominantly Omicron. Absolutely, yes. And it's not just here in Douglas County. That is true for the whole state, that we're seeing Omicron as the predominant variant.
And how is it affecting in terms of hospital, as far as our hospitals, as far as, what I'm hearing is that we're pretty much reaching capacity.
We are at capacity. There's no reaching anymore. We're there. So this morning, I believe we were at about 94% capacity for our hospital systems in the metro area. And that doesn't tell the whole story. When you actually see what the nurses and the respiratory therapists and the physicians are doing in the hospital, they're actually taking care of way more patients than they normally would. So even though we're saying, of our staffed beds, we're at 94 capacity, it's actually a little worse than that, because those people are actually taking care of more people than they would, if we weren't in this situation.
So, Dr. Hughes, it really sounds to me that, we're at a point of breaking in terms of a system, and we sit in Omaha, is a community that we rally, we come together, we fight.
Yes.
So what can we do to help relieve some of the pain points and really just, our hospital system is at a breaking point. What do we need to do?
Absolutely.
To help relieve some of that?
Well, we continue to talk about vaccinations, and even though we're seeing that Omicron has some breakthrough with our vaccinations, if you get boosted, that helps immensely to prevent some of those breakthrough cases. Okay. So if you've already gotten your series, go get a booster if you're eligible for that. If you haven't gotten your primary series yet, get in and get that. We still have plenty of vaccine in our community right now,
and
we want
free.
People to go in. It is, yes.
No, for I know you've probably said this over and over, but you're not tired of saying this. For the folks that are just hesitant about getting the series of vaccination, they have some reluctancy. What do you tell them now? I mean, is there more you can say to really help convince them that this is the right thing to do? This is part of the solution?
Sure. We continue to look at the safety profile of the vaccine, and it continues to be quite safe and really quite effective at keeping people out of the hospital and keeping those deaths under control. If you look at kind of a cost benefit, if you will,
okay.
Getting that vaccine is going to be so much better for you in terms of, maybe having some mild side effects versus catching the actual virus, which you don't know how severe you're going to be when you get sick.
No.
You really don't. And so, getting your immunity through that vaccine is a safe and predictable way for you to move forward. So the more people we can get vaccinated, the better. We still need people to wear masks when they're out in public, and especially those who haven't been boosted. But everybody should be in a mask when they're out in public and in these congregate settings, making sure that you stay home when you're sick. So if you're feeling crummy and under the weather, just stay home, take it easy, rest. We continue also to talk about social distancing whenever possible, and of course, good hand washing remains a pillar of public health and disease prevention. So do that too.
Right on. We're going to take a short break, and when we come back, I want you to talk about, really when people that are concerned about the vaccination, really, you talked a little bit about the why, but what is it actually doing once you're injected, when you have the full series and the booster? What are we trying to prevent? Why are we taking this vaccination, this vaccine? And let's talk a little bit about that.
Okay.
Because folks out there that may just people are still catching it. with that has been vaccinated already. So why should I, So let's talk about pros and cons in terms of just really the strength and the importance of that vaccination and what exactly it's going to do to
Absolutely,
help.
we can do that.
Hey, we're going to take a short break. When we come back, you'll hear from Dr. Hughes in terms of just why, what's the effects of taking that COVID-19 vaccination. Stay with me. I'll be right back. Hey, welcome back. Thank you for being here, Dr. Hughes. Benefits. So folks out there may still be unclear of why they should take the vaccination.
Sure.
Talk to us about what's in it. Some people think there's tracking devices in it. There's all kind of computers. I mean, it's crazy just the misinformation that's out there. But what, to your knowledge, why and what's the effects, positive effects of it?
Sure. Well, a vaccination, the whole point of a vaccination is to teach your immune system to respond when it encounters a specific pathogen. So this particular vaccine basically comes into your body. It is based on mRNA, but it does not go into the nucleus of your cell where your own DNA live. So there's no interaction there where the mRNA and the DNA are going to mix or anything like that. Essentially what's happening is this vaccine is coming into your body with marching instructions for your immune system. And it basically tells your immune system, hey, here's what you're looking for. This is what it looks like. Make sure that you ramp up when you see this so that this person doesn't get sick. And then your body essentially absorbs all of the pieces and parts of that vaccine and it leaves your body. So it basically comes in, gives your immune system its marching instructions and leaves. Your body then is primed and it says, okay, now I know what I'm looking for. I know when I need to respond. So when you have Omicron or Delta or one of these COVID variants that you're exposed to, your immune system is going to kick in and help fight that off. Now, no vaccine is 100%, so it doesn't mean that you might not get a mild illness or even a moderate illness at times, but it's going to do an excellent job of keeping that suppressed enough that you aren't going to get so sick that you're hospitalized, on a ventilator, or worse yet, pass away from it. So it remains just vitally important. Now, your body can start to forget its instructions over time. That's that waning immunity that we see. This is not the only vaccine that does this. Many, many other vaccines that we have require a booster shot. So this is why it's so important that people come in and get that booster to basically remind that immune system, hey, this is what we're looking for. This is what we need to fight off. And that booster is actually doing a pretty darn good job at preventing Omicron.
Yeah, and I love how you explain that, because it's just like, it's like if we're in a war and we don't, just imagine if we haven't positioned our troops all over the world in order to ready ourselves to win.
Absolutely.
And so it's kind of like what you're saying is like we have this vaccine that's preparing for this fight.
Yes.
That because if you now, what about the ones that say, well, you know what, our systems are created and built to fight foreign objects anyway, so why do we need help?
Great question. So
why do we need help?
Absolutely. So you can get immunity in a number of ways. You can also get immunity from catching the actual disease. Here's the thing. First of all, the immunity that you get from natural immunity, or getting that, it's kind of a misnomer to call it natural immunity, but getting the illness itself isn't always reliable in how much immunity you get from that or how long that immunity lasts. With a vaccine, it's much more predictable, how much immunity and how long that immunity lasts. The other thing is you can catch the disease and get your immunity that way, but you don't know how severe that illness is going to be for you. It can be very severe. We have young people on ventilators right now.
That's right.
Most of our cases right now, or the predominance of our cases right now, are in ages 20 to 39. So we're talking young people, and if they're unvaccinated and they catch that illness, they are landing in the hospital and being on ventilators. So yeah, it just remains vitally important.
So when you look at it from that perspective, when you look at the risks, I mean, when you think the risks, it outweighs the reward of really possibly not dying.
Right.
You know, and so, I mean, when you think about it, why wouldn't someone want to take that risk with a vaccination that, I don't care, like you said, you know, we've been doing vaccinations and vaccinating people for a long time. There's risks in everything. There's risks in drinking too much milk.
Yes.
You know, or whatever. And so, but when you think about comorbidities, now I want to get into comorbidities in terms of folks that are immune compromised. Talk about that a little bit, because then the risk goes up.
Oh, absolutely. You know, immune compromised people really, essentially what happens is their army in their body just doesn't function as well as a healthy body might. So you can give them those marching instructions, and they're still going to mount a response, but it might be a weaker response, and so they may still get sicker. That's why we want boosters so much in that population, especially. If somebody who is immune compromised and is unvaccinated gets sick with this, that immune system just cannot handle it. It basically becomes overwhelmed, and so you're going to see more cases in the, you know, those immune compromised folks that are experiencing those severe illnesses and those, you know, being ventilated and even passing away.
Now talk to us about really what are we defining as immune compromised, comorbidities, just kind of in layman's terms?
That's a really broad, both of those are very broad
right,
terms. So, you know, you're talking about people who have another condition on board that impacts their immune system. So, I mean, that can be probably hundreds of other diagnoses that are out there. So
diabetes,
absolutely,
hypertension,
cancer, you know, people undergoing cancer treatments. There are a whole host of autoimmune disorders out there that can impact that. People who have had transplants.
So it's pretty vast.
It's very vast. And when you're talking about comorbidities, it's the same thing. So, you know, when you have this illness that's coming in and requiring something of your immune system and your body to fight, and it's already trying to handle this other illness or illnesses, whatever those might be, it just is a struggle. So comorbidities is a very broad term.
Now, Dr. Hughes, too, it ain't like, you know, our medical community, like they can just put to the side all these other things that they normally have to take care of people with, as far as cancers, surgeries that must not be delayed because of their life-threatening. All this is on top of this pandemic.
Absolutely. And, you know, they have actually cut way back on elective types of things. So trying to really prioritize taking care of those emergent needs or those needs that have to be taken care of right away. But I'll tell you, there are people who are hospitalized and in treatments now that are much more serious because they couldn't get the care a year ago because of this pandemic. So what we're seeing right now is going to be the same thing. You know, capacity is so high that people who need treatment for other things aren't going to be able to get in and get their care, and that's going to be delayed another, you know, however long it ends up being delayed, and that worsens whatever illness that they're trying to deal with.
So and so what we're going to do, let's take I've got to take another break, but when we come back, you know, the stress that system down, because we talked about it's at a breaking point, if not, you know, ready to crumble. But I think we really got to get serious about how can people help us stress it down to begin to start to give some relief to our medical community and the folks that's out there that's just, they're fatigued, they're tired.
Absolutely.
And so this is serious, and I just hate that. I don't want to, you know, bring politics into it, but I just hate that we got off to a bad start in terms of just making it so political in terms of wearing masks and should you not wear masks or not. We're talking about lives here.
Absolutely.
And so I just think, we got to take the politics out and do what's right now for the common good of humanity, because we're at high risk all the way around. And so when we come back, let's share some of your thoughts about just seriously, people, this is what we need to do to start stressing this thing down if we really care about, if you don't do it for yourself, do it for folks in your family, people around you.
For your people in your bubble.
In your bubble. In your bubble. Hey, we're going to take a short break. Coming back, what can you do? What can you do? What can we do together to help stress this down so we can get back to some degree of normalcy? Maybe if there's even such word now, maybe a new normal. Stay with me. We'll be right back. Hey, thanks again, Dr. Hughes. I appreciate you taking the time. We're out of time. I wish we had more time, but this is very important. But as we look at summarizing really our charge, our orders, the work, how do we stress down this situation that we're in to really begin to decrease the numbers, decrease the hospitalization of people being hospitalized, all that kind of stuff?
Such a good question, and I want to start out by saying that I cannot do this alone, and my staff can't do this alone.
Right.
We need the help of the entire community to make this happen. And if there is one thing that Nebraskans are awesome at, it's taking care of their neighbors. So I know that our community can do this. Really, it remains so important to get vaccinated. If you haven't yet, to get that booster, if you haven't gotten that booster yet. Those are going to be our very best tools right now to slow the transmission of this
Vaccination booster.
Absolutely, and we have all of our vaccine clinics listed out on our website. If you go to our main page, there's a button that says where vaccination sites are, right there, COVID-19 vaccination sites. You click on that, and up will pop in both English and Spanish a list of our upcoming clinics. We do like appointments just because they help us plan, but if you don't want to do that and you just want to walk in, we take that too. We don't turn people away. So you can kind of see the ages and what's being offered at each of those clinics. We even have a really great one coming up tomorrow at Girls Inc. from 9 to 12, I believe. So recommend everybody go there. If you haven't gotten your booster or your shots yet, go get them.
Okay. And then testing, so on that site there, people, I know at Metro Community College is one of the test sites.
Absolutely.
That's where I work there, so I go and get tested there often. And I guess, Dr. Hughes, one of the things, the good thing is, over the months, I've seen the lines increase, so I think people are more conscious, and they want to know.
Yeah.
That's a good thing. So part of our numbers going up, we have more people getting tested.
Yes.
Which is a good thing, because it's better to know than not to know.
Absolutely. Knowing your status so that you can, first of all, know what's making you sick if that's the case, but being able to isolate and keep it from spreading to other people just remains vitally important. So absolutely, we recommend people get those tests. So if you're feeling a little under the weather, go get a COVID test. NOMI has a site at Oakview Mall and at Metro Community College. We also have, there are multiple other sites within the community where you can get tested. And if you go back to that webpage, right next to that button where you find your vaccinations, you can find where there's testing happening in our community. Yes, so it's right there, COVID-19 testing locations. It's going to give you a list of the testing locations. I believe if you click in there, you can find out if there's a cost associated. Some of those do maybe have a small testing fee, and others bill insurance or HRSA, or, you know, and essentially offer those free. So you can go in and you can look at all of that information. If you're going to test, you know, if you're symptomatic, you can test at any time. If you think you've been exposed, it's good to wait about 5 days after that exposure to get tested, but do it. And if you can find home tests to keep on hand, that's also a tool that you could utilize to help you know so that you're not spreading.
Well, thank you so much for taking the time. We're out of time, and so I want to thank our viewers for tuning in and really make today the beginning of your best year yet. You do that by looking inward to look out. We got to take care of ourselves. Health has to be the #1 focus for 2022. Be good to yourself. It makes it so much easier to be good to others when you take the time to be good to yourself.
Absolutely.
With that, I'm out of here. Until next time, take the time to be good to yourself.